Section 3 is a treatment section and lasts for up to 6 months initially. It can be renewed by the responsible clinician along with another member of the mental health team for a further period of 6 months and then annually thereafter. Being a treatment section, the person will already have a diagnosis of mental illness and therefore will have previously had contact with mental health services and most likely have been detained under a Section 2 previously. 2 registered medical practitioners, one of whom must be Section 12 approved and is likely to be the responsible clinician of the patient. Ideally, the other doctor will be another doctor who knows the patient and may well be the general practitioner. These doctors will complete recommendations for a Section 3 if, after assessing the patient, in their opinion, the patient suffers from a mental disorder that's of a nature or degree that makes it appropriate for him or her to receive treatment in hospital, and that this treatment is necessary for the health and safety of the patient or for the protection of other people. The treatment is not available to the patient unless they are detained under the Section 3, and the treatment must be available for the patient. The approved mental health professional will write the application for the section and inform the nearest relative. If the nearest relative objects, then the section cannot go ahead. The nearest relative is also able to write the application for the Section 3. The patient may appeal against their section to the Mental Health Review Tribunal and to the hospital managers, and may have an independent mental health advocate to help them do this. They are also entitled to legal representation. The patient may be given Section 17 leave by their responsible clinician under Section 3. Under Part 4 of the Mental Health Act, consent to treatment, after 3 months of receiving medication, the patient must either have the capacity to give consent to taking medication, which includes knowing what the purpose and likely effects of the medication are, and consent to medication, in which case the responsible clinician will write a T2 consent to treatment form. If the patient either does not have capacity to consent or is withholding consent for medical treatment, then a second opinion appointed doctor will be contacted. This doctor will review the patient's case notes and assess the patient, and also speak to 2 other members of the mental health team that are not medical doctors, and decide whether the treatment plan that the responsible clinician has written is appropriate for the patient. And if they agree with it, then this medication can be given even without the patient's consent.